Emergencies in the eastern Mediterranean region are destroying more lives than ever before. In 2017, almost 76 million people are directly or indirectly affected by political conflict, environmental threats, and natural disasters. Health security threats such as acute watery diarrhea and cholera, H5N1, MERS, and polio are also placing vulnerable lives at risk. To save the lives of millions of vulnerable men, women, and children, WHO works alongside national health authorities to lead the health cluster and coordinate the activities of humanitarian and developmental partners, including UN agencies, non-governmental organizations, and donors. Every day, up to 5,000 Yemenis experience symptoms of severe watery diarrhea and suspected cholera. The epidemic is spreading fast and affecting nearly every governorate in the country. Together with partners, WHO is working tirelessly to ensure access to clean water and sanitation services, set up treatment centers, train health workers, reinforce surveillance, and engage with communities on prevention activities. Drought in Somalia has led to lack of clean water and the largest outbreak of cholera in the last 5 years. To avert a humanitarian catastrophe, WHO and health partners have scaled up emergency and outbreak response activities, including conducting oral cholera vaccination campaigns in affected and at-risk areas. The year 2016 marked the first time in several years that WHO was able to reach all 18 besieged areas in Syria. In a landmark immunization campaign, thousands of Syrian children in besieged and hard-to-reach areas were vaccinated for the first time since the conflict began. As military operations for Raqqa, Syria intensify, WHO is playing a key role to strengthen evacuation routes, ambulance services and trauma care services for severely wounded patients, provide medicines and supplies to hospitals, and strengthen health services for thousands of displaced men, women, and children. In Mosul, Iraq, 8 trauma stabilization points and 5 field hospitals that were established near the front lines provided life-saving emergency trauma care to tens of thousands of injured patients caught in the crossfire. As more areas became newly accessible, WHO supported mobile medical clinics and teams were often the first to deliver healthcare services to thousands of people who had been cut off from aid since June 2014. WHO's Logistics and Operations Hub in Dubai has provided medicines and supplies to 10 emergency countries in the region, as well as to countries in other regions. To help countries review and strengthen their ability to detect, assess, and respond to public health events, WHO and partners supported 10 countries in the region to conduct joint external evaluations of international health regulation capacities. Technical missions were deployed to enhance preparedness and response capacities in Saudi Arabia for MERS and in Egypt, Sudan, and Pakistan for Zika. The regional office also sent technical missions to the pilgrimage season. They worked closely with the Saudi Ministry of Health. The Hajj season successfully concluded free from any major public health event or outbreak. The capacity to respond to infectious disease outbreaks was enhanced by adding new partners to the Global Outbreak Alert and Response Network in the region. Every day, hundreds of millions of people are at risk because national and local systems that support their health and lives are overwhelmed or too weak to withstand crises and extreme events. In 2017 and beyond, WHO remains committed to working with member states and all partners to protect and repair health systems affected by emergencies and save the lives of all vulnerable populations.